Welcome to Endocrine Wellness. My name is Dr. K, and today we're going to talk about insulin resistance. The purpose of this video is for educational content only, and please discuss with your doctor for your specific treatment plan. How can we measure insulin resistance? So generally when patients come to me or their primary care doctors have tested, they've usually just tested the glucose level, and their glucose level is normal, 85, 90 for fasting, and they're good. But as I talked earlier, their glucose can be normal in the initial stages of insulin resistance or in the hyperinsulinemic state. So generally for my patients, I get a fasting glucose along with a fasting insulin level. And generally I use a formula called HOMA-IR calculation. HOMA stands for HOMA, Homeostatic Model for Assessment of Insulin Resistance. And this, you can pull it up on, let's just Google search and plug in the fasting glucose and the fasting insulin level, and it tells us if the patient is insulin resistant. A value more than 2 is typically considered insulin resistant. In some of my other patients that I'm able to perform this, I do a glucose tolerance test along with the insulin levels. Generally, glucose tolerance test is done during pregnancy to just measure the glucose levels to ensure the mom is not diabetic. But in this case, we usually have the patient come in fasting. We measure the fasting glucose and the fasting insulin level. We have the patient consume the glucose, usually 75 grams of glucose drink. And then they stay in our office and we measure the glucose and insulin level at 1 hour and 2 hours after the drink. So we're able to see how much of a spike in glucose happens, and even more important, how much of a spike in insulin levels happen. I've had patients whose blood glucose is normal on the A1C and blood glucose, but if you look at their insulin levels, they started at 25 fasting, went over 1,000 at the 1 hour or 2 hour mark. And that person is obviously very insulin resistant, and it's going to take a lot of effort in terms of diet, exercise, weight loss to get that patient to a lower insulin resistant state to prevent a lot of the complications I have discussed in a previous video. And that's it today. If you find this information useful, or you think a friend or family could benefit from this information, please share the video. Please like and subscribe to the channel. If you have any more questions on this topic, please email the channel and I will try to answer them as soon as possible. Thank you for being here.